So what do we know about the current situation? Well, we know that it offers some challenges and unique opportunities for the management of work-related stress and psychosocial risk in the healthcare. We have to work together to manage those areas, to manage those conditions. If we don't, we do our employees or our members a disservice if we don't work. And we have to recognise the climate that we're in. We're in a climate where there is a reduction in money or expenditure given for healthcare. You're asked to provide healthcare at this level with this much money, and the difference between the two is often the employee that has to meet that balance.
My name is Sarah Ketelaar. I work at the Department of Occupational Health and Environment in the Academic Medical Center, which is one of the university hospitals in the Netherlands. And I'm going to talk to you about one possible approach to manage psychosocial risks and stress at work, called workers' health surveillance. First, a short overview. I'll tell you a little bit about myself, then I'll tell you a bit about what is workers' health surveillance, some research findings, the way that we are performing it now in practice, and specifically I'm going to talk about some examples, some examples of organizational interventions that can follow from workers' health surveillance.
This routine is not only produced by the employer, it's also discussed in cooperation, starting from the Swedish Act on Co-determination at Work. The Act regulates how the employer shall inform and negotiate various issues with the unions. It also allows social partners to make cooperation agreements, such as how to discuss issues and how to act toward one each other. In Region Gävleborg, we have a cooperation agreement. We have that in various levels. This routine about handling of harassments has been cooperated in the Central Union Management Committee for Collaboration.
Since the legal definition of harassment may not always conform with the individual's experience of harassment, it is important to continue to pay attention to the individual's well-being and to offer continuing support. If it has been established that harassment occurred, the manager is to assess the causes. Now, the legal regulation states that the employer should look for organizational factors that may have contributed to the harassment. It could be such factors as a high workload, unclear roles, or poorly functioning communication. If such contributing factors are found, the manager has to address them to prevent harassment from reoccurring.
Le projet de regroupement et la prévention des risques professionnels. Les salariés conviennent que l'ouverture d'une nouvelle clinique est une opportunité devenue incontournable au regard de la vétusté de certains bâtiments, tout en considérant que ce déménagement s'accompagnera d'une redéfinition de leur poste ou de leur service, et que cette réorganisation impactera leur travail au quotidien et donc la santé et la sécurité des salariés. Ce regroupement de cliniques sur un seul site va entraîner une évolution significative de l'organisation des activités et du fonctionnement des collectifs de travail. Des mesures d'accompagnement, notamment en matière de préservation de la santé physique et mentale des travailleurs. La particularité de ce projet est son anticipation.
The following features had a positive effect on health: positive team culture, supportive management behaviours, positive contribution, so actually people asking people for their input and taking their views into account and delegating effectively. Participation, Sarah mentioned earlier in her presentation about self-rostering and about how that helps people in terms of people know what they're going to do. They've got that control. Kim mentioned control as the management standards. So there's a key link there. And being kept informed. So we've obviously got shift systems in place. So not everybody can get to every meeting. So what is the communication mechanism? If people are actually kept informed, then the stress can be reduced. So the other thing that it identified was what had a negative impact on health. And again, I thank the previous presenters. The same things came out. Work overload, demand, one of the management standards, too much to do. Poor equipment. You know, when the nurse has to go to 3 different wards in order to find a hoist that works, referencing back from the Paris to Helsinki journey in terms of MSK, referencing back to, I think it was Peter's presentation this morning, but when you're in a rush, you do things quickly, and that's when you cause risk. Lack of resources, whether that's financial or human capital. Difficult work-life balance. If people are taking work home with them and it's causing pressure at home, then that impacts in the workplace as well. And of course, something else that was mentioned earlier today, work-related violence.